if we're trying to stay home and not go to the doctor, what are all the different, I go to that, folks can go to that counter at Walgreens. There's lots of different things to choose from. So what are the things that I should try as a patient if I'm feeling bad, if I have an upper respiratory infection or just sinus infection or something?
So some of the typical things that we recommend for a typical viral infection and sinus problems would be antihistamines. Sometimes those can help out, especially if you're somebody who has some seasonal allergies and which kind of predisposes you to get some of these infections easier. So taking an antihistamine like Claritin, Allegra, Zyrtec, Benadryl, any of those can help out reduce some of all that drainage that you may be having that's bothering you and making you cough and coming out your nose and all that. Some other things, newer things that are now out on the market that didn't used to be are intranasal steroids, Flonase, Nasacort. There's a new one that just came out. Wasn't there a new one that came over the counter within the last couple months? Anyways, there are choices for nasal steroids, and sometimes those can help with acute sinus infection, so you could try that out. Decongestants is another one that you could try if you don't have other conditions like high blood pressure and certain heart conditions. Decongestants like phenylephrine and pseudoephedrine or Sudafed, those are some things that you could try to help get you some relief from some of the sinus pressure and nasal congestion that you have with these. And then there's also always good old Tylenol and ibuprofen for your aches and pains and sore throat. So, and then rest and fluids is another thing. That's something that we don't think about a lot of times, but that can help as well.
I would say just a couple of rules of thumb. Always ask your pharmacist if you need help. There's a lot of products available, but if maybe you're going to a place that does not have a pharmacy but has over-the-counter medications available, when you're looking for an antihistamine, look on the box that usually says allergy on it, or if you're looking for a decongestant, it usually says sinus on the box. Those are some general rules of thumb. You don't always need to pick the product that has every drug in it. Sometimes it's better to have the individual drugs to use for what you need because you don't want unwanted side effects. I know personally for me, if I take a 24-hour Sudafed product, I don't sleep well at night. Some patients it doesn't affect and others it does. So you don't know you don't know how that affects you. That may be something you learn in the future, but don't take things that you don't need just because you think I need this all-inclusive product. Another thing related to cough that sometimes we run into, sometimes you say, oh, I have a cough. Well, is this a cough with production? Am I coughing up something, or is it a dry cough? If it's a dry cough, then we're looking at dextromethorphan as something, and again, you can ask your pharmacist. If it's something where there's production, we're looking at guaifenesin. Always drink plenty of fluids when you have those productive coughs. It always helps. But the one that sort of catches people off guard, if you ask a question, you say, do you feel like that's a post-nasal drip? Is that cough being caused maybe when you lay down at night and it's worse, or do you notice that you've got a lot of drainage? Sometimes that cough is helped just by taking one of those antihistamines, one of those allergy medicines. Sometimes you don't always need a cough suppressant or something to help get that mucus and sputum up. So make sure you're telling your pharmacist or your physician, whoever you're working with or asking questions of, make sure you give them all that history to help them give you the best medication possible. And I guess as a mom with a little boy that was sick at home and didn't want me to come this morning, a 4-year-old, keep in mind, when you have especially pediatrics, a lot of times when they can't breathe, we don't have a lot of options. You may be sucking out mucus with one of those little syringe bulbs. You may need to get a cool mist humidifier or something to help them breathe overnight. And so those are some other general rules of thumb to think about.
Thank you. And, I think we've seen too, talk to your pharmacist. They're a great resource. Our physicians work very closely with our pharmacists. So when you do go to the pharmacy, they have that line that says, ask a question. So definitely take those boxes up there and ask, is this right? These are my symptoms. And they're very helpful. So
can I add, one product not mentioned was the sinus rinses. They seem to work extremely well. There's a couple of sinus rinses on the market if you're having a lot of sinus congestion and drainage, they seem to provide almost instant relief for the majority of patients. That's for acute. And I would also advise people not to use their nasal decongestants like Afrin for longer than 4 days in a row. The likelihood of developing a dependence on that and a rebound congestion is very prominent. And once a person gets on those products and stays on them for a week or two, they almost become addicted. They can't breathe through their nose without them. So, and it's a miserable condition for those patients to have. So use your topical decongestants like Afrin just for a few days at a time.